Hi, so you've survived your first patient report and now it's time to hit the floor. But boy, I sure got a lot of information there and I don't even know where to start. Oh, and by the way, I got a note saying my patient's leaving for a test in a half an hour. I need help. So today we're talking about organizational plans, how to make your workload manageable during your shift. I certainly use them in my daily life, but this isn't going to help me here today. Instead, what I'm looking for is a template, a document where I can put all of my thoughts and care goals on one sheet so I can keep track of where I am and where I'm supposed to be. So in working with my organizational template, I've already put my patient's name in here and room number and code status. One of the first things I do is I would take their care record and chart that I've assumed care of them. I want to complete my patient research, and this involves looking at that nurse-to-nurse report, looking at the patient's file and medication admin. So when I look at Mr. Manner's medication MAR, I see I have medications at 8 and 12, and again at 1400. So I want to make sure all those times are in there. And equally, I want to make sure that if there's any assessment attached to those, that I've reflected that as well. So when I look, he's got Lantus and insulin aspart at 8 o'clock, and then another dose at 12. So usually those are connected with a chem strip, so I've added in a chem strip here at 8 o'clock and at 12 o'clock. I do need to still add in my 1400 med, so I'm going to put that here as well. Now I see a lot of IV meds at 8 o'clock, so I want to make sure that I do my line verification before I administer any IV medications. Another resource I'm going to check is the patient's orders. When I look at his orders for today, I see he has a hemoglobin of 76, pale and confused, and he has IV at 250 running, and he's getting 2 units of red blood cells over 4 hours. So I want to make sure, again, I now have normal saline at 250. I need to verify that is correctly running, and that there are 2 units of red blood cells to be infused, and I need to know the times. I've got some meds that are discontinued, more meds, and to consult the PIC team. So this is I'm going to put down here in my items to pass on, make sure that the PIC team has been consulted. And this is kind of now my daily schedule. So I've gone ahead and filled in 3 imaginary patients to kind of give you a sense of how other things can be added to your day. In terms of prioritization, Terry Manner is my sickest patient, so I'll be seeing him first. But I want to organize my day and be efficient, so I'm going to cluster my care. That means I'm going to grab his medications and grab a glucometer so that when I go in and I've finished his head to toe, I can give him his 8 o'clock medications and drop his insulin, and everything will be good to go. When I look at my other 2 patients, I see that George is going to need a turn in this hour because he's on bed rest, and I want to make sure there's no bed sores. And with that is his AM care. So I might talk to my healthcare aide and see if she can start the AM care, and I'll go see him next because I want to make sure he's turned. I can do my head to toe looking at his front and back side for skin care, and then his care will be taken care of. And then I'll go see Janice, who's my 3rd one, because she needs assistance with her meal, and by the time I finish these assessments, meals may be coming and I can get her set up for her breakfast meal. So there you have it. The benefits of using an organizational plan are numerous. Aside from being a great way to organize your day and prioritize, it's a great communication tool. If I'm stuck in a patient's room, say in isolation, or maybe I've got a patient who's decompensating, I can hand this off to my buddy nurse and she knows exactly where I am and what needs to be done. Similarly, leave it behind when you go on break. It can be a communication tool between you and your buddy nurse in terms of prioritizing her workload in your absence. Don't forget to subscribe before you go and let me know in the comments section if these videos are helping and if you have ideas for future videos. Share these with your friends and check out the other videos I have on medication administration, cranial nerves, heart, blood flow, electrical activity, and more to come.